Welcome to the Future of Medicine podcast, presented by Predictiv, the first DNA-based digital twin to predict and prevent over 22,000 diseases.
Hi, everyone, and welcome to the Future of Medicine. In this podcast, we explore how technology and science are shaping the medicine of the future. From genomics to wearable devices, artificial intelligence to at-home diagnosis and treatments, our guests will share how they foresee the future and how they contribute to it. Today, I have the chance to have my friend Ahmad Al-Hidiq. Ahmad is a serial entrepreneur and technology enthusiast who's been launching products and advising businesses for over 17 years. He is the co-founder and CEO of Kayan Health, a virtual care management platform. He's also the co-founder of Lab 8, a venture studio and firm that works with startups in bringing their products to market and helping them lift off. In addition, Ahmad is an angel investor and advisor and sits on the board of multiple startups globally as part of the Lab 8 product portfolio of startups. So I invited Ahmad today to talk about Kayan Health, an enterprise virtual care management solutions provider that delivers a suite of products which empowers healthcare organizations, governments, and NGOs with innovative communication technologies and artificially intelligent solutions. Ahmad, welcome to the Future of Medicine. So can you tell us more about you, about your background, and what is Kayan Health?
Absolutely. It's an honor to be here. Thanks for the invite. We're excited to chat. So I ventured into technology around 17, 18 years ago. Started out in engineering and slowly kind of moved into business development and product management. And I found myself always excited to build new products and to be involved in kind of trying to solve problems and trying to look at gaps in the market and challenges and figuring out ways to do that. And I launched a few businesses over my career and a few startups, and last of which around 7-8 years ago was in healthcare and health tech. We were building solutions for clinics, hospitals, doctors, both on the from enterprise medical or electronic medical records to other enterprise type solutions. And that's when I kind of got into telemedicine. I used to live in Dubai back then, and we launched the region's first telemedicine platform called HeyDoc. And over the years, we grew the platform, raised funds, scaled globally, but we always knew that telemedicine was really one solution to the problem. Healthcare organizations, clinics, providers are all very unique, and they're all trying to solve different problems. And we realized that what we need to do is look at the ecosystem, look at all the different innovations around us, and bring them all together for these clinics and providers and healthcare providers. So we shut HeyDoc down, launched Kayan Health, which is a virtual care management platform, and spent the last 2 years building products for healthcare providers. So we've built a suite of products that we implement for our clients, and it's been a fun journey.
Oh, that's exciting. That's indeed a long journey. How did the COVID-19 or how did the market evolve on telemedicine, and how did it impact you?
Well, 2.5 years ago, we had to sell the idea of telemedicine. We had to sell the idea of digital health, and we had to kind of push for, try to showcase what innovations are out there and how they could benefit, and how we could use AI to benefit, how we can use all these wearable technologies to help benefit clinics. And then COVID hit, and we didn't need to sell anymore. Everyone understood and saw the value of it. And over the past 18 months, most clinics that we've talked to and hospitals have just rushed to buy different products and different solutions to solve different types or to solve problems in different areas. And now, almost 2 years in, they have the space or the time to sit and think, okay, now we've kind of plugged in a few holes. How can we now plan for the future? And this is what we're kind of doing right now. And this is where most of our time is spent. It's running these different discovery or innovation workshops and sessions with our clients to try to see how we can use all these different technologies to solve these problems. We saw a rise in remote monitoring. Now everyone's looking into, oh, we've got all these wearables, we've got these smart devices, we've got smart scales and biosensors and other types of mobile devices that can provide a lot of insight when it comes to your health. How can we benefit from them? Oh, a lot of our clients have an Apple Watch or have a Fitbit. How can we benefit from this information? And now they're open to this. So we're looking at how can we link this? How can we take this data? How can we use their information that we've got, like from their medical records? And then how can we make sense of this? So we saw a big push into that. We saw a push into automation. A lot of things that used to happen physically and manually are being automated. And now they're looking into ways where they can automate certain things and make them make it more of a seamless experience for the patients. In the end, patient experiences haven't changed for not even decades, for centuries. You are sick, you go see a doctor, they prescribe medicine, you go back home, and then, you know, if you need to see them again, you go back and so on and so forth. Now we're looking at how can we change the patient experience too? How can we make their life easier? How can we make use of all these innovations around us to make their healthcare journey better? And that's the kind of change. We're seeing a change in patient experiences. Rather than innovation in the back end for clinics and doctors has always been there and it's always been amazing. But when it comes to the patient, we haven't seen much change. And that's the main thing that's been kind of changing recently. And that's the hit that COVID had. It caused that innovation to happen. So it's exciting times for us, especially enthusiasts in the health tech space, and we're looking forward to the future.
Okay, and I saw that you have one part of your solution is about the triage. So when the patient arrives to the hospital and to know where to direct them. And I saw that you use artificial intelligence to check the symptoms through a set of questions to receive a preliminary diagnosis and guide patients to the appropriate medical services. Can you tell us more about how it works, about how did you validate the results you provide? And apart from that questionnaire, do you use or plan to use additional information like patient medical record, or you were talking about wearables, Apple Watch? Do you plan to use that kind of information to improve even better the triage?
Absolutely. So we're using AI to help with triage because one of your first interaction with a physician is a triage session. They ask you a few questions, they check your vitals, and then they take this information, share it with the physician, so that when they speak to you, they have a better understanding of who you are. Now, this does not need to be a manual process, and this could be automated. And the way we're implementing it is we ask a few questions based on our solution, and then based on the result, we'll either let you know you need to access 911. So imagine you're feeling unwell, you're at home, you open up the app, you go and kick off a triage session. It'll let you know if you need to call 911, it's an emergency, you need to see someone now, or if you need to speak to someone, or if it's, if it's not very serious and you should check back later. And then if you need to speak to someone, we'll direct you to the right person. And then this information will be stored so that when you speak to that person, they don't need to ask you these questions again. And what we've been focused on is the patient experience, to make it really easy to answer these questions, make it really quick, make it really fast. And we're looking at different channels. At this stage, we're looking at obviously input through the app or through the web portal, but we've also built a voice-enabled solution. So what happens is you can speak to your Google Assistant or Alexa, it'll ask you a few questions, and then that will direct you towards where you're planning on or the result that you are intending, whether it's speaking to a doctor or calling 911. And we take this information and store it into the patient's records. And this has been something that a lot of physicians are asking for, just to save time and to automate. It's part of the things that they'd like to automate. And if AI can do it, then let's use AI to do it. If it's something that, it's always best to have a human do it, then we're focusing on that. We don't try not to tell you what the problem is. We don't want to freak people out. We don't trust the technology today at that much. Maybe in a few years' time, it'll be a lot more efficient and we have more data that we can learn from. At this stage, we take this data, give it to the doctor, and just tell the patient, you need to speak to this doctor or that doctor. Let's facilitate the appointment booking.
Okay, very good. And so what type of diseases or problems do you cover? Do you have some, do you have a list of categories depending on what doctor to meet, or how does that work?
Yeah, it could be anything. We cover the whole spectrum. The only area that we are working on next, which will take a little bit of time, is mental health. Mental health triage is still at its early days, at least for us and with the technologies that we're using, but that's something that we're looking into moving forward. We believe that it'll add extreme and immense value when it comes to someone's mental health. Able to ask a few questions and then let you know who you need to speak to or what your current situation is, and give you some advice on what to do next. So we're looking at mental health and we're looking at where to implement it. But when it comes to physical health, we cover everything. And eventually, as you mentioned, wearable data will affect this triage. Genomics, as you well know, will affect this triage. All this data that is around us will help make the triage session a lot better. So we're at the beginning where it's just basically input, asking you questions, responding, and based on healthcare data available to us, we're able to analyze and let the patient know. But our goal is to plug in your wearables, is to plug in genomics, is to plug in medical records to make the assistant faster and smarter to give you a better result.
That sounds really, really exciting. Today, can you tell us more about your clients, where they are located? What is your target? Because you mentioned clinics, hospitals, all those large hospitals, smaller structures, because there is a lot of competition on that market, I guess.
Absolutely.
There are many telemedicine companies, software. So how do you differentiate, and who are your clients, and how do you differentiate? Why would they use your solution rather than, I guess so many alternatives on the market?
Well, first, we are focused on concierge medicine. That's our main kind of area of focus, at least at this stage. The reason is concierge medicine is providing a concierge service. It's all about the patient. It's all about the patient experiences. So we feel that our solution would fit best there. And what we're trying to do is we bring triage, we bring communication, we bring appointment booking, we bring forms and onboarding and kind of prescription refilling forms and all of these different types of forms. We bring it, and obviously wearable integration, all into one place. And the way we do it is we white label our platform for our clients. So each clinic or each concierge clinic will have their own app that they can use, and portal that they can use with their own patients. That is our key differentiator. We don't have a cookie cutter solution that anyone can sign up to and use. Each clinic, we realize that each clinic operates differently. They all maybe need the same kind of functionality or the same services, but each of them operates differently, and they all want to have kind of internal control of how the solution is implemented and how it's used with their patients. So our key differentiator is we white label our suite of products for each and every client that they can use internally. We customize it for them and we help them scale. We lead the technology and we help them scale. Another area is we're focusing a lot on innovation. Before we do anything, we have a lot of innovation workshops, trying to understand we treat it like the startup way, basically. We look at what their gaps are, what their problems are, and then we try to build something accordingly, and we kind of plan it over a period of time. And we work with we make sure that we work with the right people internally. Now there's internal buy-in that they need to kind of innovate. They need to transform their clinic into this new era of digital health. And we work on building the right solutions for them. What we've done is we've built the building blocks. These suite of products, they're there. And then we take it and we set it up for each and every one. Each one uses a different EMR. Each one has a different audience of focus. Some could be focused on the elderly. Some could be focused on people with certain conditions. Some need a Fitbit Sense. Some need a medical grade device. Each one is very different. So we kind of tweak and and tailor it accordingly. In addition to that, sometimes conditions like tech literacy, Wi-Fi availability, and internet, and type of device being used can affect the solution. If it's someone that's got fast speed internet, the latest phone, the latest smartwatch, then their tech literacy is on a very different level than an elderly person living in a rural area who's struggling to access the internet. The implementation for them could be a lot different. The experience is different. It's a little bit more intuitive. It's more, we try to guide them towards getting the data and getting the information and guide them towards all of that versus something with another audience.
Yeah,
so
because using your solution can be also a big organizational change for hospitals and clinics, and very often do so well-established organizations. So having all that change, what is their reaction when you first show them Kayan Health? When you first tell them, okay, we could change, we can help you, of course, and this will be those changes, because apart from the technology, that's also part of the processes that are changed.
Correct. So what we do is very simply, they usually see the platform, they're like, oh, this is amazing, we do need this, or we have part of this platform through 3-4 other kind of solutions, and we love that you're bringing it all into one place. But we've got 200 doctors and 30,000 patients, and this is not something that we can do overnight. Our usual answer and our usual strategy is, let's start small. Let's start with 5 doctors and 100 patients, and then let's increase the 100 to 500, and then let's increase that to 1,000. And same thing with the doctors. And we launch internal pilots, and then we start scaling from there until we reach. It's never a 3-month project. It's always a 1-2 year engagement, especially for the larger organizations. And we plan the rollout and we plan everything. The first thing we tell them is, we're treating this as a startup within your organization, because if we don't do that, this will fail. And we have experience in enterprise solutions. I've been launching and delivering enterprise solutions all my life. And I know, like, when it comes to a big company or a big organization, this type of change, it will fail if you don't do it properly and you don't do it slowly and cautiously. And that's kind of what we're following. Now, even with the smaller clinics, even if they have 1,000 patients and 10 doctors, let's start with 1 doctor and 100 patients, and then let's start kind of scaling it slowly.
Okay, well, I really like that approach. What's your biggest challenge today when to get more hospitals, more clinics, more concierge medicine doctors to use your solution? What are the challenges you're facing today?
Time. It's a long sales cycle. It's a very, very, very long sales cycle when it comes to hospitals and clinics. This is not something, because it's really serious, it's not something, and it's time consuming, it's not something they can just jump into and do. The good thing is they want to do it. The bad thing for us as a provider is it takes time. So that's our biggest challenge, but we're able to wait it out and take our time and support them with whatever they need. That's why we invest a lot of time in these workshops. We invest a lot of time in the user experience and patient experience, in educational sessions, and into the product itself. And for us as a company and as a startup, our strategy was, let's start with the smaller organizations and then slowly start scaling up. And that's the reason why concierge, we were very interested in concierge, and it just fell into our laps. We met a few people that deliver concierge services, and we realized what we've done is a perfect fit. It's a perfect solution for them. And they are the ones, they're a little bit faster when it comes to execution, and at the same time, they know they want it. And it's an easier rollout than when it comes to a larger organization with multiple systems, complicated solutions that we need to integrate with. So we're starting there because it's an easier and a better fit. And then as we progress, we're going to start looking at other areas where this platform could be a great fit. But we're very happy just starting with concierge. It's a lot of fun, and I think we'll be able to help them immensely in transforming, because they're transforming healthcare in their own way. So helping them in their journeys is exciting.
Okay, Very good. So talking about that, what are your plans for the future? We talked about what you have today and the success and challenges you're having. What are your plans for the future? Are you working on thinking or working on any new features or products?
Yeah, we've got a few things in the pipeline. So our current product is split into 4 modules. It's the communication, wearable integration and remote monitoring. It's the triage, and it's the integration and automation. And these are the kind of the building blocks of our product, and this is how we kind of started our journey to solve those kind of 4 challenges. But as we perform and as we run these different workshops with clinics and startups, because startups is working with startups is another area that's growing for us. Companies that want to disrupt a certain kind of healthcare system, and they want to use our suite of products to build their solution that they can provide. In addition to clinics, both of them, we're spending a lot of time doing those workshops. So we're looking into setting up innovation labs across North America. So we're focused on the US and Canada. So we're looking at setting up innovation labs where we can work more closely with providers and with startups and helping them solve key problems. We've got experience in health tech. We've got a solid team and a lot of resources that can help. And we've met a lot of amazing people, advisors, mentors, investors that can come in and add value to a clinic or to a startup. So we're looking to set up and launch our first innovation lab in the next few months. And we're currently talking to a few partners and sponsors that want to kind of be part of this initiative. And we're looking at building kind of innovation hubs across multiple cities or multiple locations across North America. So that's one thing that we're very excited. It tied really closely to what we're already doing. We're already doing all of that, but we want to kind of position it and add more resources to make sure that these projects we're involved in are even more successful by adding mentors and advisors and experts in the industry, bringing them to one of our clients as we're doing these innovation workshops. I think the value that we would be able to bring is going to grow. And then the second thing that we're also excited about is we had and this is kind of a little bit different because it's more B2C focused. We had a group of interns that we worked with earlier this year. They're all university students. And as we were kind of working together, they were telling us, oh, you know, we're struggling to get access to mental health services. It's really difficult to find a therapist. Universities, wellness centers are overwhelmed. People are all over the world today. You know, we're still doing online and virtual classes. Some people go back home, or some people are local. It's been a challenge. So we started looking into the market and realized there isn't really a platform or a player that is connecting university students in specific and helping them connect with therapists the way they want to do it. They're more into texting. They all have smart health devices. They're very into their own health. They monitor their vitals and their own health. And so we thought, okay, let's take all of this and pilot it and see if students are interested. So we launched a small pilot with a group of students, and they loved it, and they're very interested in it. And we started talking to therapists who thought this would solve a big problem for them, especially when it comes to student interaction, because they're doing things, students aren't interested in the way they're doing things. And those that are interested in the students don't have the tools. So it kind of came in and fit. So we started, so we're growing now our platform. It's called Reina Health. It's B2C focused. It's run by a partner of ours, one of our colleagues. And so far we're in 4 states in the US and 2 provinces in Canada. We've got therapists there, and we're looking to scale across North America. So that's it's only a couple of months old, and we're looking to scale that, especially with universities, classes coming back, and people are back to school. So we hope that we'd be able to kind of add value in that space and scale over the next couple of years.
So you were talking about that new generation that is taking care of their health and more, of course, tech savvy and everything. So you have a solution today that enables patients to stay home, to be monitored remotely, in the future to receive preliminary diagnosis. Is it how you envision the future of medicine and healthcare?
For me, the future of healthcare is all about the patient. It's all about predictive care, mind the pun. It's all about predictive care. It's all about preventative medicine. It's all about how can we use technologies to make sure that I know what's going on, or my physician is able to detect and know what's going on before it even happens. And the past decade, we've got innovations in the tools, and the next decade is going to be innovation in bringing these tools together and making sense of all this data that we've collected in the past. I see it in 10 years where I wouldn't need to book an appointment with my physician. I would already know in advance what's going on because of all these different devices. My records are all integrated across multiple systems, and I wouldn't need to book 15 minutes to speak to someone unless I absolutely need to, but I will be constantly monitored by my physician or by my healthcare professionals, and I'll be notified if something's out of the ordinary. Instead of me kind of trying to check my heart rate or blood pressure or heart rate variability and all the basic vitals, this will monitor, it'll know what my resting heart rate is, it'll know what is out of the border of the normal, and it'll let me know if something's wrong, versus me having to check, oh, it's actually my resting heart rate is low, or it's higher than it should be, or whatever this information or this vital data is, we'll be able to predict and know what it is on a personalized case. So it's not just preventative medicine, but it's also personalized medicine. And these are the two kind of general topics that we believe are the future of healthcare, and kind of making it more intelligent, making use of all the data that we've had and making it even more seamless for us to access and get better healthcare.
So predicting, preventing, making a more personalized medicine, and a big part of it that you're working on is also the monitoring side. So that's how you see it. So how do you think the role of physicians will change? Will it be mainly to only treat the patient, I would say, at the end of the chain, but removing all those parts before about preventing, or do they play a role in it?
So I think they're going to spend less time treating things that they don't need to treat, and they're going to spend more time treating things they need to treat. And everything. So one statistic that we found fascinating, which was actually the reason why we got into our first platform, was at the time between 68 and 78% of consultations are unnecessary. People end up going back home, no medication needed. There's nothing going on. They just needed to kind of feel better and they weren't sure. So they spoke to someone. We'll be able to eliminate all of that using technology. And then the physician will be able to focus on the real problems. And them, instead of spending their 8-hour day doing in 15-minute intervals with patients, and them not remembering your name because they're seeing so many people, they'll be able to remember your name because they'll be able to spend an hour with you to help you, guide you and treat you. And then everything else that does not require a physician's attention will be handled by technology. This is how I feel it's going to be. The nature, the way physicians do things today is going to change completely. And I feel that the way the whole system is going to change over time, slowly. And maybe not in the 10 years, maybe 20, 30 years, but the whole system is also going to change because the fundamentals of the system are going to change. And it's all about, for us, the patient experience. That's what we're looking at, and that's what we are trying to innovate in. So
predicting, preventing, monitoring, treating, and a physician that will really focus on that will be really patient-centric and focus on what he brings the most value. Ahmad, thank you so much for joining us today. Kayan Health is a very exciting solution, and I sincerely wish all physicians would use a solution like that. So best of luck for this amazing venture, for that new mental health solution that you released on the market. And thank you everyone for joining this podcast on the future of medicine, and see you next week.
Thank you.
This was the Future of Medicine podcast, presented by Predictiv, the first DNA-based digital twin to predict and prevent over 22,000 diseases. Learn more on www.predictivecare.com.